want to talk a little bit now about ADHD. ADHD has been very confusing over the past, 15, 20 years for a lot of people. ADHD has had many different names. Currently, it's called attention deficit hyperactivity disorder. One can have this with or without hyperactivity. ADHD is a syndrome, meaning it can have numerous symptoms or a variety of symptoms. The symptoms come on a continuum. One person may have a lot of a particular symptom, while another person with ADHD may have a smaller degree of that symptom. So two people who have ADHD may manifest the symptoms differently. And this causes a lot of confusion for people, especially when they're trying to compare notes with one another. A person may be diagnosed as predominantly the hyperactive type of ADHD, or predominantly the impulsive type of ADHD, or the combined type. There's one other category, and that is the residual type of ADHD. This is an adult who has had ADHD symptoms and history, but was not detected and diagnosed when he was younger. ADHD always starts when a person is very young. So ADHD doesn't just automatically suddenly start when you're 30, 40 years old. There's got to be a history of it. ADHD is further complicated because there may be other overlapping concerns, such as obsessive compulsive disorder, sometimes called OCD, or Tourette syndrome, or ticking conditions. Treatment requires careful diagnosis by taking history into consideration. Diagnosing ADHD is called an exclusionary diagnosis because we still don't have one diagnostic test that will pin it down. All testable possibilities need to be excluded first. There are many different ways or combination plans of treatment for ADHD. There are also many different medications on the market. Some people prefer to try other methods before using prescriptive drugs. ADHD has been a most confusing topic and requires knowledge of a great collection of research. Back in 1990, Congress authorized major universities to research and report their findings about various aspects of ADHD. Since I was involved with the congressional inquiry, I have much depth and background for understanding, diagnosing, and the treatment of ADHD.